All right, we'll call the meeting to order. Start with the Pledge of Allegiance. Mr. George, would you lead us in that?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you. We need to approve the agenda, but I think we might have a couple of modifications that we need to do.
Mr. Chair, I'd like to add an amendment to the agenda to modify policy 2330 concerning the board agenda.
Okay.
If we can make that an action item, we will
Okay.
do it as 24A.
Okay. And could we have a discussion, if it's okay with everybody, about legal services, just not a vote, just a discussion, very briefly? So I don't know where that would need to be added. I'm assuming under maybe,
Information.
yeah,
It would be, Mr. Chair, that would fall under 5A.
so add it to 5A under information.
Do you need that in the form of a motion?
Let's see, we need to vote on, no motion for that.
No, sir, Mr. Chair. You
So we need to just do a motion to amend the agenda with those two changes that we've just made.
Yes, sir,
Okay.
Mr. Chair.
So we need a motion to add item 24A and item 5A. If someone would like to make that, and Mr. George has made that motion, do we have a second?
Second.
Ms. Fontana has made a second. All in favor, say aye.
Aye.
All right, that's unanimous. Thank you. Recognitions. Heidi Trask High School Exceptional Children's Instructional Aide, James, is it Goebel? Gobble, okay. Receives the American Hero Award. Very good. And I'm sorry, I didn't mean to butcher your name.
That's all right.
I bet I'm not the first, though, am I?
I'm in the RBT, by the way, so.
Okay.
And,
So board, we'll turn this way for pictures and bring some people up here. Let me tell them what's going on here. So back in August, James was presented the American Hero Award, as you see here. So that's a pretty extensive looking award. From the Higher Quest Foundation on the deck of the USS Yorktown in Mount Pleasant, South Carolina, by Medal of Honor recipient General James Livingston. A former Marine, Mr. Goebel has used his time since serving our country to give back to the community. His volunteer efforts include working with groups to address veteran suicide prevention, assisting the children of fallen service members as they grieve their loss, and helping fundraise for local rape crisis centers in the area. He's given time to the Salvation Army, Kiwanis Club, Snowball Express, and other local and national groups as well. He's a registered behavior tech here at Heidi Trask High School, working towards his master's in clinical health and embodies the meaning of selflessness. So I ask everyone here to join me in recognizing this award and this achievement in his life. If you would, please. Would you like to kind of talk about it and introduce your family, please?
Yep. Thank you, everyone. Honestly, this award or this recognition goes to half your teachers at every school, and so I hope you guys understand that there's folks, especially these EC teachers, that are giving so much of their time for the kids. I would like to introduce my step parents, the Thomases, and my son Kenley, who's a student at Topsail High School, and my wife Angela. So they came out to see this. So appreciate it. Yep.
Tell you what.
Got that many people coming?
Three, two, That's why Darren got one like this.
All right, thank you all for coming out. And there were no public comments, correct, Alex? Okay. So under the information agenda, item 1 is October. October is Awareness Month. This is Dr. Aiken and others.
Sorry, Mr. Chairman, I was trying to see if we want to try to make some room for put the chairs back for us. Actually, I want to just really be brief here, and I would rather both Mr. Taylor and Ms. Martina take the stage. They and their staff deserve the credit. But just to kind of recap, under the board's leadership and guidance last year, Pender County Schools and our staff began an effort to really try to raise awareness of some of the challenges that our students face, as well as the triumphs of our students and our staff. And last year we sort of dipped our toes in that process, and then this is our sort of second annual effort at that, and I think we have grown and expanded leaps and bounds. So at this point, I would like to turn it over to Ms. Martina and Mr. Taylor to talk about kind of the work that 2 different departments have done, and that's one thing I'm excited about. We really are trying to build that collaboration within the instructional services team, and this is an awesome example of our exceptional children's staff and our guidance staff coming together to make this happen. So I'm going to turn it over to these 2 amazing people. Come on up.
Good evening, everybody. Mr. Chairman, members of the board. Most of you are aware that October is a special month for us. We kicked off last week with Mental Health Awareness Week, and this week is Special Needs Week to highlight the special needs of children near and dear to my heart. And in the coming weeks, in the following 2 weeks, we will have Bullying Awareness Week as well as Red Ribbon Week. And it was a collaboration between us and our departments.
Yeah.
It was an exciting adventure.
So I was really proud of the fact that everybody kind of pulled together on this project. We got a lot of people, a lot of buy-in. And the really cool thing about it was our departments made a skeleton calendar. And when it got into the hands of the local teachers and the teachers in the building, they improved it. They made it better. They added their own little twist to it and really made it their own. So very, very pleased with the way that went.
And so we just want to thank our teachers, our counselors that helped develop this and participating, and our principals for making this happen in our schools. And we're getting some good positive feedback. Considering, we had some limitations on being close to each other, so.
And thank you guys for the messages that you're sending out to kick us off for the week. I know we've kicked off the first 2. I think, Mr. George, you have the next one for Bullying Awareness Week.
You do?
I think, yeah. That's what they told me. And then, Mr. Smith, you have the next one for Red Ribbon Week. So thank you so much, guys.
Yeah, thank you for your support.
Thank you.
So as usual, they don't toot their horn enough, but one, the principals deserve amazing credit. And I think the other challenge we had, Mr. Taylor alluded to social distancing, but trying to do this in a time when we only have some of our students in at a time, so we're trying to do remote learning, but also still make this meaningful, not only to students that are hybrid, but 100%, and they really worked hard to do that so that it's not just an in-school thing. There's a lot of activities that were embedded in the calendar that can be done through either remote teaching or even accessible to our 100% online kids. And I think that's something that they didn't mention, but I think it's really important. We've talked about the social and emotional learning that our students are dealing with and growing with. So being able to make that a part of it and not just an in-school thing, I think was something that I wish, I would want them to feel good about and tout as something that they did. So we want to make you aware of it. It is still ongoing. I actually have a picture I need to get out. Cape Fear Elementary, Mr. Kirkland, I want to say thank you. Got 2 amazing, gorgeous yellow ribbons at the very front of the school to kind of hit you right when you come in. So thank you to everybody behind me. And again, thank you to the board for the leadership. Like I said, we started last year. We did a little bit. We did more this year, and we'll look forward to next year. And one of the things I want to mention, Special Olympics was something that we were really, really excited about this time last year. We'd met with Parks and Rec. We were ready to go, and then COVID came along, but it is not forgotten. That is another effort that when we can get permission and movement to do something like that, that is still on our radar. So I just wanted to make sure that I mentioned that as well. But thank you, board members, and thank you, everybody else.
All right.
Thanks, sir.
Item 2, ABM staffing update. Mr. LaFawn.
Good evening, board members. Scott Honeycutt, the district manager for ABM, wanted to come tonight and update you on staffing with ABM and where they stand with that, so.
Is it all right if I pass these out?
Sure.
Have a few handouts here. Good evening, everyone. How are you? The handout Darren's giving you just a little progress report I did for y'all to let you know what's going on, where we're at, where we stand right now. As I told you in the previous meeting, a couple of things I was looking to do. I hired a utility / floater guy, and he is to, like I said before, he is to mainly handle the west side. I have another gentleman that I'm looking at to do the east side, but their main job is to handle light bulbs and ceiling tiles around the schools, which will make it a little easier for the day porters and the night staff. Still looking for the east side. The west side staffing right now, we're at 100%. I've hired 7 new hires. Staffing's really great. The schools look good. East side, I'm at about 95%. I need to hire 4 more people and 1 more day porter. 2 day porters. I've met with most of the principals. There's still a few that I have to get around to, and we're all working with one common goal, mainly for cleanliness and sanitizing, to make parents, aware of what's going on. The other thing here, Darren and I have talked, and we're looking to make a video for the teachers to let them know what is actually happening at night in the cleaning, so they know, they have a little more understanding of what we're doing at night, cleaning wise with the alpha, how it's set, so that way they get a little more comfort in knowing that their classrooms are actually clean, because a lot of them don't see that during the day. Move some staff around to help cleaning around some of the schools. Other thing I'm looking to do is hire a training manager. This manager will go around to each school, whether it be a day or 2, and he will make sure that everybody's properly trained on the way they're supposed to clean the school, how they're supposed to do the sanitizing and the alpha sprays and things like that. We're looking to rearrange the supervisors and get them more evenly distributed between the 2 of them, because the east side has 6 schools, we have 10 over here. So we have 16 schools, and it's split up as 6 and 10, so my supervisor on this side is way overworked. So I'm looking to split that up between the 2 of them and maybe possibly hire another supervisor, we're not sure yet, to split this side up to make it 5 and 5. And that's about all I have. Is there any questions, concerns, comments?
Well, it's good to see that you're back almost 100% across the county.
It's made a big difference. As we were walking around the other day, Monday and Tuesday with the last week with the bid proposals, the schools look way better than they used to. And there's a couple things y'all will see in the proposal, but I think, all in all, just in the month that I've been here, I've seen a change in the way things are and the attitude of people. So, thank y'all. Y'all have a good evening.
Thank you. Before we move on to the next one, do we have someone from the health department that's here somewhere that's going to talk to us when we get to that item? Okay. So we do. Okay. Okay. Just making sure before we got down that far. All right. Item 3, custodial contract update. Mr. LaFawn.
Board members, as you're aware, ABM's custodial services contract expires December 31st. The RFP for custodial services was placed on all appropriate sites on September the 23rd. The process is underway. Bids are due to us tomorrow at 2 o'clock. The bid opening is at 8 a.m. on Thursday morning in Building 300 if you're interested in attending. Once the bids are open and they become public, then they'll be shared with you. The electronic version will be sent to each one of you for you to review. We'll do our work and get a tabulation sheet for you, and once the tabulation sheet is done, that will also be shared with you. We hope to have a decision by October 29th. Is there any questions that you have?
No.
Thank you.
Okay, thank you.
Well, you see the presentations to the board, can we discuss that for a second?
Yeah.
Mr. Chairman? So it says October 22nd on this, which I've got, Beth has got a locked out time of 2:30 to 7:30. How many,
We had 10 contractors to come to our original informational meeting. I'm sorry. I apologize. Yes, sir. There were 10 contractors that came to our original informational meeting. I won't know how many actually choose to bid until we get the bids open, received tomorrow. There was one contractor that opted out. So I'm expecting 9 bids.
after tomorrow, does the board want a presentation from 9 contractors? Or do you want us to kind of look at what we've got?
I'd rather I personally rather use your expertise, and then instead of us having to listen to 9 contractors to present what, you feel like is the most, that's my opinion, what's most qualified then for us to vote on. If you have a hard time, you get it down to 2 or 3, that's fine, but I just don't think it would be wise use of the board's time to listen to 9 contractors.
Yes, sir.
Unless y'all just change your mind.
I would like to see the proposals though, of all 9.
Absolutely. Absolutely. You should have the proposals sometime on Thursday.
Yeah, I concur, top 3
Okay.
should.
Okay.
Thank you.
Ms. Chestnut, budget report for the board. And item 5, fuel and electric cost. If you want to do both.
I have got to put this mask down because it fogs my glasses up and I can't see. Okay, on the budget report, just so you know, we're not in the hole with anything. It may look like it with some of these red numbers. The biggest one is in Fund 3, and the reason you're seeing red there is Ms. Martina and I have been talking about it. We have the money, they just want to approve the budget. And of course, all that is actual payroll expense, which we can do, but we really are hoping they're gonna get that straight. And in Fund 4, the reason you see that, that is all those purchase orders for the buses that are paid for by the state that we're required to have out there, but you have no budget for it until they send you the money. It's weird. But anyhow, I just want you to know we're not in the red anywhere, even though there's some nice red numbers on here. Yes. So do y'all have any questions about that? Okay, and then the fuel and electric reports, kind of like we've been talking about before. It's kind of hard to even know because, this is the beginning of the 3rd year with strange stuff. So, but it is. You can see where we're at with that. Y'all have any questions about that? And is it okay if I mention about getting the food service proposal? Okay. Just to keep you updated on where we are with the food service proposal, that we actually got extended last year. I have been, Lynn Harvey's probably going to block me. She is our NCDPI person that we have to make happy with all the stuff. And I've been talking with her, and she had originally said that I could do nothing until October 15th, which is coming up. So I actually have a phone conference with her scheduled for Monday to go over some of the things that we need to do. We're having some discussion, as you know, last year, usually we change the numbers to whatever the previous year was. Well, that won't work doing this, because last year was a really strange year, and it completely would skew everything up. So we're gonna discuss how to actually put the proposal out that we had with some caveats to it, so that, you know, we can get it on out. So I'm hoping and praying that after the conversation with her on Monday, and I think, Brandon, you're the one that reviewed it, there shouldn't be so terribly much review if it's left, except for changing a couple of things. I'm really hoping to get it out, and so we'll have it back, so we'll be ready to move on it. I'm really trying. I have not forgotten it. I just wanted you to know that. Thank you.
Okay, thank you. Item 5A is, we've talked a little bit about our legal representation, and two of us have already met with a representative from the School Board Association who talked to us about the process that we would follow if we were to hire our own staff attorney, that type of thing. For the other three of us that have not heard that presentation, is that something that y'all would like to hear? We would do it at a work session or a committee meeting or something of that nature sometime. Is that, anybody like to hear that? It lasts about an hour. If so, we'll schedule
Because
that.
that's a very, very important, decision to be made. I mean, if that was the
Yeah.
route, I want to know all the pros, cons, and
Yep.
that's not something to take lightly, so I would
Right.
want all the information I can get.
And I was the other board member
Yep.
who attended that meeting, and I will say, I think I would encourage you to take it under advisement.
Yeah,
Please,
they have a lot of
please
good
do go look
information
at it. Yeah,
that-
talk to them, because they were very helpful. They'll answer any questions that you have. It was a really good presentation.
I just, we're at the size that our system is now, and with the amount of money that's spent, this might be a good way to help in a lot of areas. So, okay, well, I will get that scheduled with the School Board Association and get up with everybody about it, see what times work and so on and so forth.
That sounds good, thank you.
All right, thank you. And the consent agenda, which is items 6 through 20. Do we have a motion to approve all of that, or do we need to do anything separately? Or if everybody's okay with it, we can do one motion to vote for all.
Mr. Chair, I make a motion that we approve the consent agenda as presented.
All right, Ms. Fontana has made a motion. Do we have a second?
Second.
Mr. George has made a second. All in favor, say aye.
Aye.
All right, that's unanimous. Under the action agenda, item 21, COVID-19 Elementary School Operations Review. Dr. Hill and others.
Yes, sir, we're here to update the board on the recent numbers, kind of to add, well, not to add, but to talk about the information we've shared over the last couple of weeks and the new numbers that have come out this past week, and hopefully give you enough information to make a decision about the option now that the governor has allowed us to possibly consider option A. Dr. B will put up the presentation. And while we're waiting on that, we also have Ms. Steele here from the health department to talk about the health and safety side of this. Obviously, we have a lot of doctors on staff, no number of medical doctors, so we rely heavily on them. We've got a great relationship. Okay, this one, we've got a couple of keyboard, or people, cabinet members that may want to speak to these slides.
Can we get, does this TV work for it too, so that the audience can see?
Yes, sir. That's, go over some information, but we just like to, every time we meet, to talk about what's going on in the school system with the numbers. And so the numbers you've got here are the current enrollment, virtual versus in person. They haven't really changed in the last couple of weeks, not that much since the last board meeting. So they are what they are. Next slide. And we would ask that Ms. Steele, Shirley Steele from the Health Department, come up and give a report on the current numbers that are happening within the county, and as much as we can answer questions.
Good evening. So I thought I'd start out by giving you an update on the state and the county numbers. So the state, as of today, has 234,481 positive cases, 3,800 deaths, and which brings us at a 7.1% of the positive tests. We have 1,142 cases in Pender County as of this afternoon. 97 of those are offenders at Pender Correctional, if you deduct those from the 1,142, that brings us down to 1,045 positive cases in Pender County. 962 of our residents have recovered. 7 are currently hospitalized, and there have been 9 deaths in our county. The highest age range of cases has been in the 29 to 49-year-olds with 459 cases, followed by the 50 to 64-year-olds with 227 cases. The most cases have been in the Hampstead area with 367, followed by Rocky Point. And since I reported last week, the Hampstead area has increased by 42 new cases. The CDC indicators and thresholds for risk of introduction and transmission of COVID-19 in schools, which we have been using as a guideline, and which I shared with you on the call last week, and then Carolyn has shared with you on September the 24th. If you look at number 1 on the indicators there, the number of new cases per 100,000 persons within the last 14 days, we are currently still at the highest risk of transmission in schools. We are greater than 200. We're right at 220. We were at 200 on 9/24, moved to 231 on 10/7, and have since decreased to 220. And if Mr. George had asked me to back out the correctional center numbers when we spoke last Thursday or Friday, whatever day it was last week. And if I deducted the 61 numbers, it would put us back into the higher risk category instead of the highest risk category. Number 2, the percentage of PCR tests that are positive during the last 14 days. We have moved to the higher risk of transmission at schools. Based on our previous number of 6.7, we are at a moderate risk. On 10/7, we moved to the higher risk of transmission at 8.3, and today we are up to 10, and the state is at 7.1%. And the state has increased since we last talked from 6.4 to 7.1 today. Number 3, the schools continue to do a great job implementing all 5 mitigation strategies. Number 4, the percent change in new cases per 100,000 population during the last 7 days compared with previous 7 days has moved from higher risk of transmission to highest risk of transmission, and we continue to be in that highest risk category since October the 7th. We are greater than 10%. Number 5, percentage of hospital inpatient beds in the community is the same, has not changed. Number 6, the percentage of occupied intensive care unit beds in the community is the same. And number 7, the percentage of hospital inpatient beds in the community occupied by patients with COVID-19 remains the same at less than 5%. Some other things that I just want to share with you. From October the 6th, which we spoke, I think, October 7th last week, through October the 12th, we have had 53 new cases, but 23 of those are tied to Pender Correctional. We have a 10% positive test rate compared to the state that has 7.1%. And looking at the increase in cases in the age range of 0 to 17, that number has gone from 167 on 10/7 to 184 on 10/13, which is an increase of 17 cases. Transmission does not seem to be happening in the community. Does seem to be happening in the community, not in the schools. As we talked about on the call also, the health department does not have staff for surge capacity. We had recommended that the schools look at trying to hire a nurse dedicated to COVID and use the health department as a resource, similar to what some other counties are doing. To summarize, our indicators are scoring in the higher thresholds. And even though we are scoring in the higher range, does not preclude you from moving forward. But with the parameters trending upward, it may be safer to wait until next semester. We have been collaborating together since the kids went back to school. We have a great team approach with Pender County Schools. But as I said a minute ago, we don't have adequate staff to handle an outbreak or to increase the daily call volume. We are a small staff with responsibility for the entire county. And I'm available for questions.
So if you back the prison, because my understanding is the prison just counts as numbers. We provide no services to them other than because they're located here, we report their numbers.
Well, and let me just clarify one thing. We do have to collect the information and get that entered into the state database. But we don't have to do contact tracing with them.
So if we were to back those numbers completely out, we're at what, 6.8% instead of 8.1?
For the percentage of test?
Yeah, for number 4, I think it is on the.
For percentage, well,
For number 2, I'm sorry.
yeah, because, number 4, even backing those numbers out, that number didn't change. Number 2, for the percentage of, based on, I did not back those out. I can't do that without my calculator. I did not back those numbers out. I just backed them out of the number 1, because that percentage of positive tests during the last 14 days, you have, the reason why, and I don't know that I could give you an accurate number, because it would have to come from the state, and the state doesn't back that number out, because I don't have the percentage of all tests. We don't get all the positive results as quickly as we should, and we definitely don't get all the negative test results. So that would be a little hard for me to give you that number.
So that number could be skewed anyway?
It could be. Well, it wouldn't be at the state level because they receive everything, but if we had to calculate that, it would be. I'd take the number directly from the test website. From the state website. And it's based on the database they have there. And the state doesn't collect negative test results.
So number 6 says 80 to 90% of our intensive care unit beds in the community are occupied. How many beds is at Pender Memorial?
We don't house anybody at Pender Memorial for COVID. They all get transferred immediately to New Hanover. And I can't tell you off the top of my head. It is on the website.
So this is saying that 80 to 90% of New Hanover's beds are.
This actually, and this is the state numbers. I did look at just at New Hanover today, and it was definitely in the lowest risk of transmission in schools for just New Hanover. Did not include the numbers I have here are for the state.
Hey, Mr. George, you have anything else?
I'm done.
Okay. Based on the numbers that you're presenting tonight and with the plans that you have seen us, because I know you've been part of the working group with our cabinet, and then we've been doing some meetings on the side with 2 board members per meeting. Is it the health department's recommendation to give any type of recommendation to this board and decisions that have to be made based on what you see that are our options tonight?
Well, we are available for guidance and to present the facts. And just as I said in my summary, we are trending higher. And on the call that I was on today, the state has spiked. The number of hospitalizations, there's a spike. All the positive test results have all spiked. So we did say that we would recommend waiting to the spring semester based on the trending upwards of the numbers.
Because currently all the counties surrounding us that were the highest reported cases, is that correct?
You mean the number of
The number of cases? Or
No.
that we're in the top percentile? Or?
No, our numbers have gone up more so than surrounding counties. We were in the top 20% of
Okay.
reporting cases. And actually, our number skyrocketed last week. The week of 10/9, it was the highest number of cases we had reported in the county at 112. But as far as the number, we are in the surrounding counties, as far as the number of positive tests, we are actually the lowest county as
Okay.
far as overall tests from when COVID actually originated here.
And statewide, looking at the state's website, we're trending close to the lowest in statewide. It's just a
For the
spike
number
was-
of cases, yes, except right now during this spike, we have been at the top. Yes, that's
So-
correct.
We did have 112 cases reported last week, but prior to that, it was averaging around 50 cases for the past 54 cases for the past 3 weeks prior to that. That 112, how many of those are outside of the correctional?
112, I can't exactly tell you that because to date, we are at 97 offenders total. And out of the 112, let's see, if that was last week, Phil, maybe
Well,
I
on
can't, hang on a
10-2
second.
On 10-2, there was 35 Pender correctional cases. On 10-5, there was 72 Pender correctional cases. And on 10-7, there was 93. And on 10-9, there was 95.
Well-
So from 34 to 95 of those 112 are correctional cases.
I can say this, the week of September the 28th through October the 5th, we had 83 total cases, and 38 of those were correctional, so that left us in the county 45. And then the week of October the 6th through October the 12th, we had a total of 53 cases. 30 of those were in the county, 23 were in the correctional facility. So in the 14-day totals, which is what I can tell you for sure, we had 61 correctional and for a total of 136. 75 were in the county if you deduct the correctional numbers from that. So 136 minus the 61, we had 75 cases in the county, based on our calculations.
Yeah, I pulled these numbers off your
Okay.
reports off of
Did you match what I just said? I'm sorry, I didn't keep
It's
track of what you
close.
said.
I did 7-day totals.
Okay,
So, because it doesn't show y'all the paper report on weekends.
no, we
So I pulled
don't.
the numbers off of the daily paper reports.
Okay,
So looking at it, like I said, there was, on Friday, October 2nd, there was 35 correctional cases. And then on Monday, October 5th, was 72. And then by October 9th, that Friday, there was 95. And that's the week that we counted 112.
12.
So the majority of those were out of Pender Correctional. It looks like it's kind of leveled out over there because the reporting's not showing any new cases. Yesterday, or I don't know about today, I didn't see today's report.
We're up to 97
So
today.
it's kind of leveled there too.
Let's hope.
So even though 112 is a huge number, and anybody that's got it is a concern, but the majority of those aren't out and about in the county. They're confined to one location.
That's true.
Did you say earlier that you're not equipped with enough staff if there is a major outbreak that takes place in Pender County? Is your staffing numbers not adequate enough to address that?
Well, you've got to remember, we are handling the entire county, and that includes long-term care facilities. And so when we say we don't have adequate staff, if we would have several outbreaks in the schools, then yes, the school nurses would have to take on more responsibility for investigating those cases. And we're always there for a resource. We're always there for support. But as far as making those phone calls, we would have to have additional support in order to make those phone calls and determine everybody that was a contact.
All right. More questions for Steele? Thank you.
Thank you.
Yeah, this is just one more additional slide. We were requested to, what does it look like internally? If you only looked at the case, that's kind of blurry. Is that, I don't know how it looks on the screen. Is that clear on the screen for you guys?
I'm looking at my handout.
But basically, this is the trajectory of what's going on inside the school system, week by week. So, just to show the board what's going on there.
And that's not necessarily inside the school system, that's the students that are assigned to our school system, correct? These aren't positive cases from being in school. They are students that are assigned to our school system, right? I mean, the way I understood you said it, this is what's going on inside of our school.
Inside of our system, yes, sir. The students that attend our system. This is representative of the student body.
Okay, but they're not caused by students. This is not a cluster in the school.
No, sir, we haven't had a cluster in the school. No, sir. So that generally speaks for itself. It's a pretty easy graph to follow. It's just where it's heading. Next slide, please. We show this board have access to this 24/7. We show this at every meeting. Basically, these are the numbers where we're at now. The top two numbers are what's active, and the bottom numbers are cumulative.
I have a question about the dashboard, because I watch it a good part of the day. It's up and running. It fluctuates all day. Like today, it dropped down to 44. What causes that fluctuation during the day like that? I know cases are inputted. I thought they were inputted the first thing in the morning.
Their input, and then based on the data that goes into it in terms of people, students, or staff that are quarantined, it's date-based. So if they come off, like today's come off, then that number will go down. If somebody gets added in, put into the quarantine or isolation by health department directive, and the date is active, and that goes on that number.
So as they're doing their tracing and they're getting more information,
Right.
they type that in, it's live. So as soon as they type it in, it affects the
Gotcha.
dashboard. So as they're doing their investigation, this thing updates every 5 minutes.
So do they pull out also, or does it automatically drop them as their time expires?
Yep,
It
it's based
automatically-
on their start and stop times, yes, sir.
And that's when they go into the cumulative when they come off.
Next slide, please. Dr. B.
So, all of you have seen this. This was the survey that was. Thank you, Mr. Riley. This was the parent survey that had gone out regarding Plan A or setting change. And so this has not changed with the exception of some hard copy ones that came back, and we've added those in. So, in a nutshell, and I have to get up very close because my eyes are getting worse as I get older. Currently, 86% prefer to keep the same setting, regardless of whether it's virtual or face-to-face. And in terms of preferring to go to Plan A, I'm seeing that 58%. 58%. For Plan A, and it's 14%.
It's 31% for no and 11% for unsure.
I can't see at all. So those numbers have not changed at all. And then with the staff survey, we have 70% that do not prefer to go to Plan A, 17% that do prefer, and 14% that are unsure. So again, those numbers have not changed.
One quick question about the staff survey. So, refresh my memory. What did that question ask?
That was for do you prefer Plan A? For both the parent survey and for the staff survey, it was after watching the video that Mr. Riley did, do you prefer to go to Plan A?
Okay.
Because we were currently at the other plan. So it's just very straightforward.
So it was just just the question was, do you
Yes, ma'am.
prefer? Okay, thank you.
Mr. LaFawn, you want to talk a little bit about some considerations?
Some of the things that, consider, obviously, transportation is a big piece of consideration of what's going to happen if we make any changes in how the kids are coming to school. Route design or redesign is the last puzzle piece. The kids have to be scheduled, and those schedules have to be entered into Power School before transportation has access to the data. Once that happens, it really becomes a redesign of the bus routes. Our best guess with the data that we have is we'd be looking at about 2 weeks. 1 week to take care of the elementary schools, K-5 going to Plan A, and what to do with the 6-8. Can they actually, with 6-8 being on a different requirement, how many of those siblings can ride on the elementary bus, and how many new bus routes will we have to create to handle what could not ride? And then folding or collapsing the high school cohorts from 3 to 2 would also take about a week. If you have specific questions about that, you can ask, but that's basically what the timeline would be. Our classroom space, again, it's hard to predict, just how many students are going to come back. In elementary school, I think it should be we should be okay, because under Plan A, we do not have to keep the 6-foot spacing. Middle and high schools obviously still have to do that, and the more students that come back, the more complicated that will become. So again, if you have specific questions, we can answer those. But I think it's a mathematical problem, and we don't have all the information until we have all the information. We can't get it yet.
Basically, board, what we're doing is these are the things we're going to have to collect information on if we revise any plans either way. So just to make you aware of that, these are things we'll be working towards. Dr. A.
Yes, Mr. Chairman and members of the board, so as we started talking with staff and principals, these are some of the considerations, and as Mr. LaFawn said, really, regardless of where we go, these are just considerations that will have to go into play as we try to determine whatever plan we want to implement. They don't really, the questions themselves are not predicated on any one plan. They're just things we'll have to look at. So obviously one is that with our current Plan B, by having students assigned to cohorts, when we have had situations where we've had to have students stay home, it has only impacted essentially half of a group of students. We know that as we add more and more students into a classroom, whether that's on a cohort or not, that is something that we'll have to deal with. We are aware and working very hard that as we have students come back, that will obviously impact teacher-student allocations in terms of who's with which teacher. Which teachers may be teaching any number of platforms, whether those be online, hybrid, or for some of our staff, that is something they have to do at the same time. As Mr. LaFawn said, that is difficult to predict until we actually know exactly which student is coming back for which teacher. But irregardless, that's something we will have to work through and be looking at. In a larger perspective, our principals have worked hard, but we'll continue to have to deal with having some teachers who may be able to teach solely online classes, and we may have some teachers who, on the flip side, we only be able to teach only in person, and then we may have some that may have to do both. It just depends on the number of students that come back, which ones may leave, that kind of stuff. And then we do know, regardless of when any shift happens to occur, it is going to obviously impact any student-teacher relationships that have been established. We know our staff will work really hard to do that, but it is something we'd have to deal with. We have talked at length with our principals regarding the Wednesdays. That is something that, as we move forward and have students come back, that is something that has proved extraordinarily valuable for our teachers for a number of reasons. So one is the fact that our teachers are having to teach multiple ways. Having those Wednesdays to be able to provide instruction to either the 100% online students or maintain the hybrid instruction has been very important. With the way that our students now have to no longer be able to eat in the cafeteria, the playground situation, our teachers are staying with their students far longer than we normally would have. Another advantage to the Wednesdays is it does provide time for IEP meetings, parent phone calls, things they might normally do during a planning period that we can't right now, or during their lunch period for that matter, which a lot of teachers do. That has proven to be very valuable. It has also provided time for our teachers to work together. Again, because they no longer have some of their planning periods or their lunches alone, the time that we used to have teachers work together to do some cross-grade level or cross-department conversations, they have lost that time. So as we move forward, that is one thing we would like to continue. And then I know there are also some human resource considerations to share as well.
So good evening again, board members. So kind of piggybacking on something that Dr. Aiken mentioned with regards to student-teacher ratios that would play into this. Adequate school staffing due to COVID-related cases. As we've seen in previous weeks, we had one situation where 9 staff members had to be quarantined at once, therefore trying to get coverage for those classes. Those are some situations that we would deal with if we did not have a number of substitute teachers readily available. And then, of course, as mentioned to you, we have some who have some accommodations due to medical, pre-existing medical conditions. Those are some things that would have to be considered too when it comes to staffing and how that would work, particularly too in looking at the different platforms for the instruction.
And thank you all for all presenting this. As everybody knows, the online stuff has been real messy, mostly thanks to Edmentum, in my opinion. But I've gotten probably a couple of hundred emails at this point, people having different struggles with it. And Dr. Blumenreich and Dr. Aiken, you have answered the majority of them for me, which I appreciate. And I'm just sorry that our students have had to put up with some of the stuff with online. I know that all of y'all have tried, but you can't help when other places fail. And that's kind of what Edmentum has done, in my opinion, and what I hear even from staff, usually privately, that, you know, Edmentum's pretty much a joke. Has always been my understanding. So anyway, sorry about the side note. All right, any more staff on this issue before we vote?
Yes, sir. Basically, what we looked at was taking into consideration all the numbers that have been presented tonight. We basically have three ways we looked at this. We always try to find some way where there's another option in the middle. And option one is you can maintain kind of what the health department talked about until the end of this semester, or actually relook at it in November. Option two is full implementation of Plan A for pre-K to 5th grade per the governor's announcement, 4 days a week, Monday, Tuesday, Thursday, Friday. Option three is to allow the online folks who are currently dealing with some of the virtual things at the elementary level, not admit them, but allow them to come back, which is kind of one of the more boisterous crowds. And what that would look like is basically option one is the cohorts we have now. Option two is 4 days a week. You'd be increasing the population in the schools by 104%. And option two, you'd be increasing the populations in the school by option three by 13% to 14%, which would be a little more easing into it, and then relook at the numbers again in November, because right now they're the highest point they've been in the system. And we would just that's basically what we developed option 2 for. Well, here's the examples that we actually added up. So this gives you a good idea. Option 1 is 2 days, Monday, Tuesday AA, Thursday, Friday BB, like we're currently doing. EC has the options every day as mostly self-contained, and we're working through IEPs, kind of a pyramid method, MTSS, as they work into IEPs requiring them to have 4 days. Option 2 would everyone would come back, and that would bring us up to basically a little over 3,000 students inside the system a day. Again, 104% increase. Option 3 would be cohort A, which would mean we'd stay with the 2-day cohort, but the people who are virtually could have the option to come back, and EC would have the option to come back every day. So we would speed up that process with them IEPs and give them the option to 100% come back. So again, the big deal is, I guess, based on the numbers you've received tonight from what the school system has to offer from surveys, but basically the numbers, the hard numbers from the medical professionals. Option 1 again is stay the course until the end of the semester, or at least until we review it again in November. Option 2 is double down on everything coming back, 104% increase. Option 3, ease into it, review the numbers again in November with a 13% increase. Our recommendation is somewhere in between, and we recommend option 3 at this time. But again, we will follow the board's direction.
So, Dr. Hill, the number of schools in the state that's continuing to open under Plan A is increasing daily. It's up to over 60 now today. And we talked about maybe finding out some information from how those big districts like Guilford that's got 80,000 students, how they're doing it. And did we get any of that feedback from them or union or?
Yes, sir. We actually looked at Guilford. You mentioned that in our last one. And what we're finding is that it lists them as going to A, but it doesn't give you the whole plan. Guilford does not. Their high schools are all on C. So they freed up all those resources to provide that at the lower levels. That was one of the things we saw. Some of the other districts may have dedicated busing that took years to create, but they don't have to mix buses at the elementary and middle school level. So they're able to have those resources that help them assist in that process. Being back in Guilford and some of the other counties that are doing that, once you get into the county and start reading their plans, they were able to expand those programs because they already had a virtual academy established, and they had an elementary virtual academy, so those teachers never taught online. Our teachers are doing both based on the resources here in Pender. So we have researched those. We're learning as much as we can, preparing whatever direction we go.
More questions?
That's my understanding. It's my understanding, Mr. Chairman, and having our meetings, work sessions between now and then, that all the way from the transportation department, personnel, superintendent, from what we heard from the health department, is that I've not heard any cabinet member speak out in favor of going to any other option except for option 3. It would be my fear, even though I do want to see our children go back to school, and I have a daughter in public schools, but it would be my fear that if we do vote to pull the trigger, and almost, I think it said what is percentage of teachers not prepared or saying that they're not comfortable going back. What was that number? 70-something. So you're talking about 77% of your staff members that would not be for pulling the trigger. I would just ask the board just to really consider the advice of those that are working this every day. The teachers in the classrooms on the front line, the principals, superintendent, the bus communications, everyone that's telling us that to go with the third option. Of course, we get the final say, but I just right now tonight I would just encourage the board just to consider what the facts are based on what our staff members are telling us.
I just need some more clarification, because we have to look at Plan A and we have to look at option 2 and option 3. And Dr. Akins, I guess my question for you would be, even if we stay with option 3, the main concern I have, and a lot of principals in this room sitting here know this is my concern, and I understand about numbers in schools, but it's very difficult when I hear from teachers that it is getting more and more impossible to do face-to-face and virtual. And whichever option we would go to, is there any discussion about what we're going to do about that in the future?
So most of our schools, all but 2 to my knowledge, have had at least some arrangements to be able to make that happen. And to answer your larger question, any of those options does not necessarily cure nor ensure that either one of those 2 things happens. Our principals have worked very hard as much as they can to try to create several situations. One would be that a teacher only has in-person and never has online. We have some situations where it's the opposite. We've even had where the principal has worked to establish by cohort day. So on A days, for example, they may only have online, and B days, they only have in-person or vice versa. And then we have situations where they have in-person and online every day. It is an extraordinary challenge. I've had the chance to watch a couple of teachers do it. I think they're doing amazing work. We hear from other districts. I did talk to Brunswick County again today, and I'm actually hoping to go visit next week. That's what they're dealing with, and that is the greatest challenge they face. I can't say that any one of those is going to ensure for a fact that no teacher across the district has it. It depends on the number of teachers they have in a grade level. It depends on the number of students who may choose to come back. We know some say they're going to leave. That was based on an initial survey. I don't know how many will commit to that when we re-release this information tomorrow. It is, I think, every principal and teacher's desire that we only ask teachers to do one or the other. But I can't guarantee in no case we'll be able to do that in every single case. But that is everybody's intent. I don't think anybody wishes to do that or put a teacher in that position. It is a distinct difference between us and some of the larger districts like Guilford County and some others that have made the decision to put elementary students 100% virtual online. As Chairman Hall indicated, that has not always proven effective, and certainly for elementary students, I struggled with that decision. The presentations that I saw, I just can't see asking a student to learn, especially K2, K3, on a third-party vendor. And so that's one of the reasons we kept our students with us. So it is a goal. It is a desire to have it, but I can't guarantee that we can say in no circumstance at any school would it be there. They have tried very hard. And like I said, I think the majority of our situations we've been able to have that. There are some schools where we haven't been able to have that happen, or we've only been able to do it to a minimum degree, again, based on the number of teachers per grade level, number of students, how the cohorts fell out. We did the cohort assignments, and then people decided to leave, so some of our cohorts are also wonky. So it's not a 50-50 spread, the way I think some people kind of imagine it being, that it's like 50A and 50B. It depends on the school who left and where they went. When it is blended, majority of the time what you're looking at is 11 to 10 students in person, 2 to 3 online. Again, that's a variation. That is not, I'm not saying that's exact, but that's often what you see. It's less than 5 online, somewhere between 7 and 10 in person. The teachers that I've observed doing it, that's what they're working with, and they have the laptop up and they try to communicate and stand there with both. They try to get feedback to both. But I don't think any teacher is exaggerating the difficulty level of what they're facing.
Dr.
It is
Aiken,
absolutely true.
I'm sorry,
Yes,
sorry to
ma'am.
interrupt,
No, no.
but what percentage of teachers are we talking about who are doing the face-to-face and virtual?
At the same
in
time, I'd have to
tandem?
get you that. I don't know that number off the top of my head, but I can definitely get you that.
Speak up.
So all of Penderley Elementary are doing face-to-face plus for K.
Okay.
I only have one grade level that has a fully virtual teacher. Everybody else is full virtual.
Everybody else is what? I didn't hear what she said.
Everybody else is doing both.
I have kindergarten and Malcolm's Corner that is doing both. Fifth grade was doing both, and we were able to fix something, but it's still not the greatest situation, so.
How many do you have virtual in kindergarten?
Oh, gosh, I can't remember off the that spreadsheet.
I can get it.
15 or so, I'd say. There's a few in each class, and we put them all on like a cohort day, so that at least the teachers do get some sort of just face-to-face teaching on the cohort D day.
So I can say like at South, the only reason why I could do it in second grade was because I had the exact number online as the class sizes of the two classes that don't have to do virtual teaching. But in first grade, let's say, if I pulled my virtual students out, then my two other first grade classes would have been over capacity because we still have to have the class size max of 21 at this point. So if I pulled just my virtual kids out, I would have been at 25 or 26 with my in-person classes.
And I think that's an important point that I'd want
I was gonna ask
the
that.
public, yes, the public to know, is that the class size limits that exist in K-3 do not go away for online. They stay in place. So even if we wanted to give a third grade teacher 26 students to maybe take care of a situation, we're not allowed to. They pull those class, and Dr. B can correct me if I'm wrong, but DPI pulls the class allotments and class rosters, and they're not concerned with whether it's face-to-face or online. They just see teacher, number of students, and if we're over, we're over. Format is not part of the equation. But I can try to get you a percentage. Okay.
So either option that you have, either of these options, how long would it take to know what our hardcore numbers are gonna be? So whichever way we vote tonight,
Right.
how long would it take? Because we've got to move quickly, because it's not fair to these principals sitting out here that we have to go 5 or 6 or 7 days. Because I would think, and I know we're talking to the public, but I would think as a parent right now that no matter if my child is virtual, I would be able to tell you if we went with option 3 whether my child was going to be able to attend or not. If we have it all laid out, what this option looks like. The same thing with option 2. I would think that it wouldn't take us long to be able to determine. Am I talking inaccurately here to the other board members? To those of you out there, I would think it wouldn't be hard to send something out, because we just don't need to let this go on and on and on and for 4 or 5 or so many days. And we're looking at a week to get bus schedules straight. Is that what I'm hearing? Where's Mr. That's what I'm hearing also, about a week?
Once all the data is in place, it'll take about a week to get K-5 straightened out.
So an easy way of thinking about it is kind of a 3-step process. You'd have to send out a survey to say, now, this is the way we're going, what do you want to do? We take that, and we have to spend time creating the schedules. And one of the things the public has asked, if I only knew, well, they may lose their teacher, they may change their bus route, they may change their time. I mean, there's a lot of things that we'll send that back out, and then there'll have to be that opportunity. How many of those now decide, I don't want to go that route now because of that or this or that other situation? So it's going to take us at least a couple of weeks to pull transportation and those surveys. And how long do you want to give people to survey? I mean, what's long enough? I mean, we've tried to judge that, and we try to give at least 3 to 5 days just to collect the information, because we always get in trouble if it doesn't carry over long enough for people to realize what's going on and run the campaign. So I'm not really sure, other than we try to put together some dates that we thought we could pull off, and we really pushed to bring those down as much as possible. So it would take us at least 2 weeks, to pull this off, at the minimum. And that would mean turning around, telling parents, you got to turn it around. You're not going to have the weekend to get this survey. You're going to have to, whatever you tell us in 48 hours is probably what we're going to be working off of.
Well, based on the amount of discussion out on social media and our emails we have received, I think most parents pretty much know which one they would prefer, or what they would want to do. Maybe that's just me talking, but that's the way I look at it. And I think the next discussion that we also need to remind people of is that we don't know that whatever we decide to do, that the governor won't come back and change and say, for middle school, and we have to be thinking forward, because there's a lot of chatter out there that may happen soon. So we didn't think this would happen this soon.
It's not as easy as just opening the door, though. That's what we're trying to explain, and people don't realize it until you try to do it. There's so many dominoes. It sounds, like we could just, oh, now we're just gonna add these, but every time we try to make these plans and redo these routes, I mean, I think that's just what we gotta consider. It's gonna take some time, because we don't know what the restrictions, we don't know what we don't know. And I think that's the harder thing to talk about here. And I'm just asking to give the team enough time to make some decent effort at getting it close. It'll never be right. These are the best of worst situations. And just to give us the opportunity to put that together and have a decent plan that has the option to actually work when we implement it.
And I'm like Miss Montana, I think the whole board's gotten these emails that she's talking about from parents. But then I think when the parent finds out what all it takes to put this puzzle together and realizing there's a lot more pieces to it than just send them back, this is what we want the kids to go back. I think then they pause and say, okay, well, what needs to be done? Because one, I think our pledge is that we want to make sure of the safety of these children. And I know every board member agrees with that. Mental health safety, the physical safety of them. And, I know the parents want them back, and I agree with the parents. But if we are not equipped to put this puzzle together in a timely manner, and we're going to send kids back into the classroom just to get them back in there because other counties are sending their kids back in there, are we making the right decision?
And it's difficult. I think the easier way to explain it is, a lot of times you see the governor talking, he says, well, now you can do plan A, now you can do plan B, now you can do plan C. We'll be doing potentially plan A, B, and C at the same time. That's what I don't think is ever discussed.
And we're already doing more than what some counties are doing anyway.
Yes, sir.
Okay.
We started off doing more than most counties.
Ms. Fontana, I think one thing that's really important, you mentioned that we don't know what may change from an announcement. So in addition to needing to communicate this out immediately, starting tomorrow, we are also going to need to communicate with our middle and high school parents about semester 2. So that is something that is a part of whatever communication goes out in the next 24 hours. That is something that we want to put in there, is begin that conversation so that we can start finding out now potential plans for semester 2 starting in January. The commitment that we asked our community when this first was rolled out was just the first semester. So as we communicate this decision out tomorrow, at the same time, our intention is to begin communicating out to middle and high school parents about semester 2. And I know we're going to be discussing high school in a second, but either way, we're going to need to take a look at what that is. The challenge, though, is we don't know what we're going to be operating under on January 7th when we come back. But we had always said to our parents that we would reopen semester 2 for conversation. Our high school specifically are already in the throes of trying to do master scheduling for the second semester. So I just wanted to share that. That was an important point, that we're trying to plan not only for right this minute, but we're also trying to look at semester 2. And one thing we want to do earlier and hopefully better is start gathering some of that information about what parents think they're going to want to do. And I realize even as a parent, I can't tell you exactly what I'm going to do semester 2, but I think most of our parents can give us a good idea. So we want to communicate that survey out to 6/12 as we're communicating this out, so we can go and get that information in to help our principals begin looking at what semester 2 may look like and the number of students that may or may not be returning.
When is semester 2 start date?
January 7th, sir. Unless someone please correct me if I'm saying that wrong. I'm pretty sure, I think we have work days the 4th, 5th, and 6th. I just want to add to that.
Well, don't go anywhere yet, sorry. You're our go-to
should've
right
stayed
now,
over there.
sorry, you should have known that.
I should've
All
stayed
right,
over
so let's just suppose we go with option 3. So I'm just gonna put it out there, you know what's getting ready to come. If we continue to have those remote days, what are we gonna do to help our families who are drowning in the amount of work that's going home?
So
And I'm just gonna put it out there,
Yes, ma'am.
whether people like it or not, I'm gonna put it out there because I have to speak for everyone. What are we gonna do about that? We have families that have several students. We have families who are working all day. They're coming home. I'm sorry as I can be, but I have had, especially this weekend, some families call me or see me and say, we are dying as a family, and we can't. I've also had families who have told me that they are not going to have their kids do any more work because they just can't keep up.
So a couple things I would say. One, I'm going to start with the teachers. I do think it's important that, going back to your comment earlier about the work that our teachers are doing, trying to do 3 different worlds at the same time. As we know it as of right now, our teachers are going to face the same accountability measures that they ever have. And our teachers feel that no matter how much I or the principals or our directors try to tell them, we get the reality of the world you're living in, but they feel that measure for accountability and for growth. And after 3 years now between Florence, COVID #1, and now COVID #2, as far as the fall semester, they face a pressure to try to continue instruction as though students are still there. And that has led in certain circumstances, and I have heard from parents, that in the attempt to continue instruction and ensure it's being covered and ensure there is no question about not having enough to do, our teachers face the pressure to make sure that if they have to choose between 2 complaints, you haven't sent enough or you sent too much, well, we can defend sending too much. We can't defend not sending enough. And we get both. I've had emails from both. You're not sending me enough, you're sending me too much. The steps that I think we'd like to see was, one is I would want a parent to always know they can communicate with their teacher. If there's work that's being redundant, if it's the same worksheet, if it's 100 times to answer really what we need to know about math in 5 questions. Those are some long-standing challenges we have faced with our classroom teachers. Communicate with the teacher, communicate with the principal. We have already started conversations with the principals about what can we do with our Wednesdays. In the spring, we had a very clear diagram laid out each day, hourly expectations. We actually still have those in place. That is something we're trying to work with, that you don't have to do 6 hours of school on Wednesday. That was never our intention. That was not our goal. We want to try to make sure that it's an approximate amount for each subject. But of course, the thing is, though, what takes you an hour might take me 3 hours. And that's the kind of thing where we need to kind of know that from the schools. Something else we know that's happening is with the work we're doing with iReady, we do have circumstances where a teacher is doing iReady, but then also sending something that actually does the same skill. We're trying to work through those with the teachers, that needs to be a reasonable amount of what we ask kids to do on Wednesdays. So there's really 2 parts. One is individually, we need to know when it's wonky. Either it's not enough or it's too much for a student to reasonably try to do. The other part is we work with, what are we collecting, what are we giving feedback? I don't wish to see situations where we're giving out work, but we're not actually providing feedback. And one of the things we want to do with teachers is say, hey, give out enough that you can provide feedback and assessment, but it doesn't need to be more than that. I don't know that I could say how to do that every single kid, but that is the mission, and that does need to be it. For me, it's about feedback. Any work that goes home, the purpose of it is to get information back from the student and give them feedback on how they did. If we're to the point that we're trying to cover so much work that the work being done can't actually be given feedback because the teacher's overwhelmed, then that's something we can work with, and we can figure a way out to do that. I've also heard parents say the number of different online resources, iReady, Zern, Google Hangouts, and we've heard teachers get frustrated with the number of different things. And those are things we can streamline as we talk to teachers and work with schools to figure out what's the most effective. iReady seems to be pretty popular, seems to be working pretty well from what I'm hearing. The Google Hangouts work well. Zern has been a long-time resource. We've had that in place for quite a while. So I do think we can take a look at what are we assigning, what's the purpose of it, and also making sure that we're not going above that structure that we put in place back in the spring about how long a day is. It doesn't need to be 6.5 hours to 8 hours, and we don't want it on a computer. One of the things we're trying to work on is, regardless of which one of these we end up with, because hopefully we're imagining the Wednesdays would stay there. I don't want a kid on a computer 8 hours on a remote day and then coming in being on a computer 8 hours during the school day. Part of the idea is to get the kids up and moving. And in the spring, we were very effective at that, I think. So that's a long-worded answer to your question, but I think it's a couple different things that need to take place.
Well, and I'm just speaking for myself personally, but the instruction we're receiving on those remote days as far as what the kids have to do is great. It's just when you compound it and you add it all up, and there's just others who are just in the same predicament. They have jobs, guys. They have careers. They have lives, and it's very, very difficult. So
Understood.
I have to speak up for everyone. Sorry.
No, very fair. I just want to make sure that the teacher side's heard, and the fact that the same teacher can get two parents with the complete opposite request. You're not sending me enough. You're sending me too much. And the only way we can deal with that is to talk directly with each of those parents, so we can try to figure out, you know, I know districts that used to have rules about you can only assign an hour of homework. And it creates an instant conversation, because what takes my kid an hour might take yours 15 minutes, but it might take your kid 2 hours. And then the 2-hour parent comes at the teacher with, it's only supposed to be an hour. And the only way we can fix that is working directly with the parent to figure out, is it the work? You know, is it, you don't actually know it, in which case, yeah, it's gonna take a long time. Let's fix the instructional part so you know what it is. Are you doing more than I asked you to do? Or, in fact, have we assigned too much and we need to pull back? Any of those could be at play at the same time, I think. But no, it's understandable, and in a time like this, when you have all the other stressors in the world, it compounds itself. And I know I've heard from parents, and I can say as a parent, when you come home, you don't want to then still be doing school. You'd like a chance to talk to your kid, and I can respect that.
No, it's just a stressor for everybody.
It is.
This is a no-win for anybody.
Agreed.
It's just not, people. It's just not. It's the
Agreed.
way it is. Thank you.
Thank you. Questions?
Actually, Dr. Aiken, I did have one last question for you. I'm sorry. Option.
I need my steps.
That's okay. Option 3, so any student with an IEP would be able to come back to school, not just prioritized as to how many
Right.
hours they have. It's,
Correct.
if that,
The important difference, really what we're saying with that was that under option 3, we'd open up to also the 4-day, not just the 2-day. But
okay,
under either plan A, because whether it's option 2 or option 3, both utilize what we're now allowed to do under Governor's Plan A in terms of class space. So with option 3, the benefit would be that anyone who wanted to return on their cohort, they could. So immediately the issue of coming in at least 2 days a week is taken care of. Then the question will be looking at the opportunity for them to go 4 days. And we have some of our parents through the IEP process that have wanted that. We've had some that didn't. But the nice thing about option 3 would be that is option would be available to all of our EC students as well as our ESL students.
how about 504s?
I would think we need to take a look at the situation.
Okay, thank you.
Yes, ma'am.
More questions?
Mr. Chairman, based on a recommendation of our cabinet, health department, and majority of our teachers, I'd like to make a motion that we go to Plan 3, I believe is what the cabinet was suggesting.
That's option 3.
Option 3, I meant. And what would be the start date of that? Sorry. November 2nd.
Okay, Mr. Smith has made a motion. Do we have a second?
So just for option 3, let's make sure we got this right. Option 3 is we continue the cohorts that we have now. We bring in the virtual people that want to come back. And we add the EC. Is that correct? And we do that for 2 weeks. And then
Review
we,
the numbers again at the next board meeting, November 10th, would be the recommendation. That's next steps.
is that agreeable? November 10th, is that too far out? Or is that close enough? I mean, that puts us right at the Halloween possible spike, I'm assuming, if we're planning on, it'll be right at 2 weeks from Halloween. I'll second that motion, option 3. Thank you.
Okay, Mr. George is seconded. All in favor say aye.
Aye.
That's unanimous. Thank you. Item 22, high school cohort consolidation.
I'll introduce it. But basically, Board, from your direction and from what we've been looking at, would it be possible in the beginning, when we looked at the numbers, we created a 3-week cohort based on the regulations and the population numbers that we had on hand. The board asked us to review those numbers and look and see if possibly consolidating those. This is just a holder slide to kind of start that discussion and what we've worked on. Dr. Aiken can fill us in on the details.
Yes, sir. Mr. Chairman, members of the board, so the last several days, the high school principals, Dr. Lee, our secondary director, and myself been discussing some possible ways to move forward with this. In conversations through the that I think it is a very doable situation. We believe we could start November 2nd. Just a couple things that the plan being put forward would be for the remainder of the first semester, in large part while we gather information about the second semester. And it's the numbers that we looked at are based on our current in-person total enrollment. What we would see is right now, I shouldn't say C, currently right now, cohort C is in. Next week, we would rotate back to A, which would be their normal week. And then on the week of October 26th, that would be B's normal week. Starting on November 2nd, we would be able to start implementing this. It's probably easiest to say the way that we would be doing it would be by blending B in pieces to the current cohort A and cohort C. But our schools have already, thanks to Dr. B's department with accountability, have already pulled classes. We began looking at master schedules. We have identified some sections here and there that because the high school is still under B, and I think that is important to understand that the Plan A, the governor announced, only freed up classroom space at elementary. It hasn't gone away in middle and high. We have identified sections here and there at all 3 schools that will need some special attention, trying to figure out either furniture arrangements so that we can maintain the 6 feet, or possibly looking at same subject, but we might need to swing you over to a different teacher in the same period, that kind of thing. But they're working on that. But we believe that we could start this, and working with transportation, even with the elementary situation, we could rotate it in. One of the advantages to November 2nd is that no students would miss any additional time. That was one of the things we want to make sure. We didn't want to create a transition and then some students being out even longer than normal. What we would see is that the cohort B students, some of them might actually get 2 weeks straight just because we got the situation in. Everybody else would be on their initial normal rotation, and then from there on out, it would be every other week. Kind of just going November 2nd, you'd be in school, remote the next week, and then back in, and we would keep that all the way through the end of December until the exam period. So our recommendation would be to move forward with a 2 cohort situation. We would want to begin communicating this out tomorrow to our schools if approved by the board.
So when does the first 9 weeks end?
October 16th, this Friday.
So I'll put them 2 weeks in before we get some
Yes, sir.
kind of. And we don't think there's any way to do it the week of the 26th.
When we've looked at doing it the week of the 26th, the way that we would have to merge cohort C, who's in right now, some of those students might end up being out for 3 straight weeks. And that was something that when that realization hit, I was just really uncomfortable with the idea that some kids would be out. By doing it November 2nd, we're able to keep the rotation in, and actually the only side effect would be that some cohort B students would actually get 2 weeks straight. I mean, I would hope that that would be considered a benefit for most, but if we tried looking at the 26th between the master scheduling and transportation, and then we realized I'm not sure that we would be able to ensure that no students missed additional time as to kind of what they're used to for the pattern. And then, of course, while we're doing this, we would start collecting data about the second semester. We're not going to wait around any longer.
Well, high school teachers, the ones that teach multiple subjects are drowning. I mean, that Wednesday, I think the ones that I've talked to, that's what they're
I think
hoping
that
that'll help them catch up and breathe.
our K-8 experience has taught us that under these circumstances, I think that Wednesday is critical. And our plan would be to institute it the same way we have for K-8, combination of reach out. The last Wednesday that it was actually a work day, but I think it speaks to what our high schools did. We actually had teachers giving up the planning they could be doing on an official work day. Because this was not a student day, this was actually an assigned teacher work day. They actually had kids come in small groups, maintain all the distancing, but work with them directly. We had people doing parent conferences, making phone calls. It was actually a perfect model for what we want to see. And so that would be something we would continue, and you kind of utilize that K-8. One benefit would be K-12. We'd really be able to talk to parents. If we had situations where we need to do multiple students from a family, now we have a day that all of our teachers could get up with them. So I think as we do that, and we're still dealing with this remote thing, like Dr. Hill said, where we're running 2 school systems at the same time, I do think those Wednesdays would be critical.
Mr. Chair, I make a motion that we approve this change to the current high school cohort effective November 2nd.
All right, Mr. George has made a motion. Do we have a second?
A second.
Ms. Fontana's made a second. All in favor say aye.
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 Any opposed? Okay, unanimous. Thank you.
Thank you, Mr. Chairman.
All right, item 23, Board Policy 1710, 4020, and 7230. Dr. Moore.
Ms. Steele, thank you.
Okay, so while I sat back there, I realized that the nomenclature on the ones that are on the agenda slightly different from what the actual policies are that you have in your packet. So the policies that you have in your packet, 1710-4021, 7032, prohibition against discrimination, harassment, and bullying. And the other 1720-4015-7225, discrimination, harassment, bullying, complaint procedures. And so to pretty much explain to you what has taken place here at the August board meeting, I presented to you what was listed as 2 new policies that came as recommendations from the School Board Association. But through legal review, what we realized is that the 2 policies that we already had in place, we just needed to go in and plug in additional information and make the revisions to current policies rather than implementing the 2 new ones. So that's what I'm bringing forward to you now is Board Policy 1710, 4021, 7230, prohibition against discrimination, harassment, and bullying. It's an existing policy, but again, it's being presented with the recommended revisions through what School Board Association has shared and through legal review.
Brandon, do you have anything that you could add to that?
Sure. Board, in looking at the proposed revisions from the School Boards Association, what our office did was we simplified the Title IX revisions that were required and made it such that you would not have to wholesale rewrite a policy that is perfectly good and doesn't need it, and simply do a cross-reference to your recently revised Title IX policy to enable folks to easily find Title IX and not have to go hunting too much whenever they are trying to find where and how they can file a claim under that particular policy. That is the crux of the 2 revisions you'll see, not only 23 but also 24.
Thank you.
Okay.
All right. Anything else for Dr. Moore on this one?
I don't.
Make a motion to approve the revisions to Board Policy 1710 and and 40217230, prohibition against discrimination, harassment, and bullying.
All right, Mr. Smith has made a motion. Do we have a second?
I'll second.
Oh, sorry, go ahead.
Oh,
Okay. Ms. Burns is seconded. All in favor, say aye.
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 All right, that's unanimous. And Dr. Moore, 1720, 4030, and 7235.
Pretty much same information, just implemented revisions.
Okay, anyone have any questions for that? Not, do we have a motion to approve it?
I make a motion to approve it.
Mr. George has made a motion. Do we have a second?
I'll second.
Ms. Burns is seconded. All in favor, say aye.
Aye.
All right, unanimous. Thank you.
Thank you.
And item 24A. Which is
Mr. Chair, I asked for
2330.
this, I asked for this to be added to the agenda. It's policy 2330 concerns our agenda and how it's communicated to us and when it's posted. Staff has to run around in circles during the weekend, sometimes before our meeting, to get the agenda and all the supplemental packets to us. I'd like to make an amendment to this policy that states that we have the agenda and the packet, the agenda published on the Tuesday prior to the meeting the following Tuesday, and our packet to us no later than Thursday of that week. And that'll give us time to, we'll have Friday and Monday with staff, if we have questions that we can contact right now. If we get it at 5 o'clock on Friday, everybody's gone. So all we have is Monday to hunt them down. So I'd like to make that a part of the permanent record. That way maybe it'll keep Dr. B from having to spend his family time on Friday night and Saturday morning and this week Sunday, putting everything together for us, which I appreciate you doing that. Sorry you had to do that. Anything that's not submitted to whoever's putting together the packet for the agenda does not make it to the agenda. All the supplemental information should be presented to the board members prior to the meeting so we can review it. It makes it tough. We got our last update to this agenda today at 2:15. So it makes it very tough when you're riding down the road headed here to have additions to your packet. So with that, I need to make a motion to suspend the second reading policy.
All right, Mr. George has made a motion. Do we have a second to suspend the
Second.
policy?
Second.
Ms. Fontana has seconded. All in favor, say aye.
Aye.
And unanimous.
Now you have to approve this policy change.
Someone want to make a motion to approve the policy change then?
I make a motion that we approve the policy change.
All right, Ms. Burns has made a motion. Do we have a second?
Second.
Mr. George is seconded. All in favor, say aye.
Aye.
All right, that was
Thank you, Mr.
unanimous.
Chair.
Thank you. All right. Comments from board members. Start with Ms. Burns.
Well, I just wanted to say thank you to Dr. Aiken, Ms. Martina, and Mr. Taylor. I think it's a great thing what we're doing this month with all of the different awareness weeks. And sometimes I think that you have to shine a light on some things that have stigmas that aren't typically talked about or much less we're not educating our students about. And I think that we're heading in a right direction with that. And I thank you for that. As far as the vote tonight, I want everyone to know that I know that all 5 of us have struggled with this decision this week. We've talked a lot about it. I know I prayed a lot about it. And I know there's no right answers to this, but for myself, I felt like we went with the decision that is the safest. So thank you for everyone. Thank you for what you're doing. And that's it.
All right, Mr. George,
I have nothing, Chair.
Ms. Fontana,
Nope, I'm good. Thank you guys for all you're doing.
Mr. Smith.
I have nothing.
Okay, well, neither. Very good, thank you. Dr. Hill.
Yes, sir. First of all, I just want to say thank you, board. I mean, I know this is a difficult time. It's hard, and we appreciate everything that you're going through and trying to support us and make these difficult decisions as we kind of pick the, like I always say, the best of the worst case situations. And we'll get through this crisis. It seems like the last one, and we'll do it together. But thank you. I do want to remind everybody that we did finally cut the ribbon. That's some good news on Pender High School's walkway. That's been generational, trying to come into realization. So hope everybody catches that. This is FAFSA and College Admissions Week. So even though I know we're in the middle of a crisis, time moves on. And it is, like Dr. Ake was saying earlier, time to get ready, start to get ready for graduation. So we've got a lot of programs going on to actually try to get kids to fill out that FAFSA. That's free money for college. And I'm just taking this opportunity to make sure they hear that at home. If you haven't filled out your FAFSA, please, please get that paperwork, ask for help. We will help you get that FAFSA filled out. It's extremely important. And just a quick update for the CF Pope vote to change Burgall Elementary School to the new name. Mr. Buchanan, there he is, hey Mr. Buchanan, has been working diligently with the Alumni Association, and I think there'll be some very good news coming next board meeting to talk about that and support that decision. So just want to let you know that work is ongoing.
Okay. That it?
Yes, sir.
All right, we have already, Brandon, do we have any additional items for closed session? I think we've finished everything.
No, sir, we do not.
We just need to vote on the HR report, correct?
Yes, sir, Mr. Chairman.
All right, do we have a motion to approve the human resource report?
Mr. Chairman, I make a motion that we approve the HR report as presented tonight.
All right, Mr. Smith's made a motion. Do we have a second?
A second.
Ms. Fontana has seconded. All in favor say aye.
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 All right, that's unanimous. Do we have a motion to adjourn?
Mr. Chairman, I make a motion to adjourn the meeting.
Mr. Smith's made a motion. Do we have a second?
A second.
Ms. Fontana has seconded. All in favor say aye.